Welcome to the Strokecast. A Generation X stroke survivor explores rehab, recovery, the frontiers of neuroscience, and how to peel a banana with one hand.
Hello, I'm Bill Monroe, and welcome to episode 35 of the Strokecast. This week, stem cell therapy. But first, some news. I was recently invited to join King 5, local NBC affiliate's afternoon show, Take 5, for a segment talking about stroke in young folks, about this podcast, and about the upcoming Heart and Stroke Walk from the American Heart Association. If you'd like to check that out, you can go ahead and visit strokecast.com/take5, and that will take you right to that video. So you can go ahead and watch me on local TV, and I know that is exactly what folks have been looking forward to catching in their next online video viewing, of course. Speaking of the Heart and Stroke Walk, that is happening tomorrow, Saturday, October 13th, over at the Seattle Center, starting as early as 8:30 in the morning. So I will be participating there and looking forward to checking out the various booths that are going to be set up there. I understand Subway has a really popular one there, so that should be awesome. And of course, the American Heart Association is showing off their Fast Room, where folks can stop by the Fast Room and take a look and experience what stroke symptoms look like, with different ways of simulating arm weakness, facial droop, and other things. So if you're in the area, go ahead and check that out. If you'd like to contribute to my fundraiser for the Stroke Walk, you can still do that. Just head on over to facebook.com/strokecast, and you'll see the link for it right there. Also over on the Strokecast page on Facebook, at facebook.com/strokecast, I've also been posting some videos there, including my latest thoughts on what we mean when we talk about strengthening the muscles through PT and OT. And it's not what we typically think of as strengthening muscles. So you can go ahead and certainly check out that video and the other random thoughts I do through various Facebook Lives. In terms of other resources that I have put together, well, not really resources, but I also have a new personal website, a personal landing page. If you're really interested in checking that out, as well as checking out some of my pre-stroke videos, you can see all of that over at currentlyspeaking.com. So, with that stuff out of the way, let's start talking about this episode. We are going to be joined by Dr. Nirav Shah. Now, you may remember Dr. Shah from episode 27, where we first talked with him about some of the research that's happening in stroke and stroke recovery, and about really what inspired him to go ahead and pursue a career in neurology. So you can certainly go ahead and check that out over in episode 27, or just go to strokecast.com/Nirav, Nirav. And we're going to have Dr. Shah on future episodes as well. So if there are any topics you would like to learn more about and hear from a neurologist about, go ahead and let us know what I should ask him about in our next interview. If you haven't heard that earlier episode, Dr. Nirav H. Shah is a fellowship-trained neurologist and subspecialist in cerebrovascular and stroke medicine with board certifications in neurology, stroke medicine, carotid neurosonology, transcranial Doppler ultrasound, and neuroimaging. He is a practicing neurohospitalist and stroke medical director at Swedish Medical Center in Seattle, which of course is the place that helped put me back together. Academically, he's interested in emergent and critical care neurology research and is an associate editor for the Neurohospitalist, a peer-reviewed journal. He enjoys mentoring trainees and collaborating on publications and conference presentations. Outside of clinical care, Dr. Shah is collaborating with experts to develop scalable technologies capable of ameliorating healthcare's challenges. He consults with startups and investors to develop technologies and devices so that one day they are available to patients. He's worked with companies to meet FDA regulations for approval, as well as to help them understand the provider perspective on product market fit. Dr. Shah is also the CEO and founder of Sentinel Healthcare and a passionate traveler and photographer. And in additional news, Dr. Shah's startup, Sentinel Healthcare, was just featured on GeekWire, announcing the platform that allows IoT devices like select fitness trackers to actually communicate with doctors through a service to help patients better manage blood pressure and hopefully minimize the risks associated with hypertension in the future, like, of course, stroke. So definitely check that out. And with that in mind, let's talk with Dr. Shah about stem cell therapy. So, welcome back to Strokecast, Nirav, our first two-time guest. This is awesome.
Thanks for having me back.
So, what I really wanted to talk about today is something we've been hearing a lot about in the press, and it's been popping up in support groups all over the place now. And that's some of the new studies that have come out talking about stem cell therapy. So, Nirav, what are stem cells?
That's a great question. So, stem cells are what we refer to as progenitor cells. And what that means is they're the cells that differentiate into other types of cells. So, when we are conceived in the womb, we have general cells, these stem cells, and they subsequently differentiate. And so they eventually become the difference between teeth and brain and hair and skin and so on. And so stem cells offer us this big hope because they're the undifferentiated cell. And so it's theoretically possible, and it's been done in petri dishes, where you can take a stem cell and create any number of tissues that are your genetics. And so the exciting thing about stem cells for almost every part of healthcare has been, can we regrow some part of the body? In our case, we're going to talk about stroke in the brain, but it's been done for heart disease, for joints and arthritis, and pretty much everything.
And just to take a moment here, a little bit of a tangent, but I think whenever we talk about stem cells, we instantly get into a lot of controversy, and especially in the US, around questions about abortion and those issues. But that is for embryonic stem cells.
That's correct.
And these are completely different type of stem cells. So regardless of how you feel about that issue, it's completely irrelevant to this discussion.
Right. And that's actually a really good point. I mean, we probably should have addressed that at the beginning. Because these are stem cells that you have throughout your life, these stem cells don't have the ethical considerations that embryonic or fetal stem cells could. And so it's one way we've moved past the ethics debate to start the research that's needed.
A lot of folks are getting really excited about this, and that's having some very positive and some negative ramifications. And I see in comment threads where people are, thinking they can go ahead and spend $50,000 and get fully recovered. And some folks are like, well, why aren't we doing this all over the place? And if this is the solution, what's going on? So I guess that's sort of the question, especially after the promising results out of Stanford and the news media. What is going on with this stuff?
That's a great question. It's a really important topic. I've had patients ask me as well if they could get stem cells. They tell me about how they know they can get them in Mexico, or there's, I think there are a couple people who will off-label place autologous stem cells in the setting of stroke or any number of conditions.
And what does autologous mean?
Oh, good point. So autologous means stem cells from your own body, as opposed to donor stem cells from someone else's body.
Okay.
Auto means self, and therefore yourself.
Gotcha.
And so the concern is that people have a lot of hope and a strong desire for recovery, especially after stroke.
And having hope is really important to recovery and to not giving up.
Exactly. No, you're totally right. And so I think in general, it's great to participate in these novel therapies as long as they're in the context of research. And the concern I have when patients share XYZ person in Mexico or Florida or elsewhere doing this type of work off-label outside of the bounds of research is that there's a potential for harm or just charlatanism, and the person could just lose their money because of this this conviction and desire for hope, which is so strong and easy to take advantage of.
Right. And a lot of times, a lot of this stuff is happening outside the regulatory environment, and sort of navigating that can be very, very complicated. So what's got people so excited about Stanford?
Yeah, let's talk about it. So Dr. Steinberg and others from that group did a study that was published a couple of years ago in 18 patients where they drilled a hole into the skull and injected.
And not doing it to just release the demons from the brain.
Yeah, exactly. No. We're 100 years from when we used to do that. We moved on. So they injected people's autologous stem cells from their own body, back into the stroke bed. And the idea is perhaps these stem cells will just naturally...
And the stroke bed is...
The stroke bed is where the stroke occurred.
Okay, so it's like the damaged tissue.
The bed of damaged tissue. Yeah.
Right.
And so they injected the stem cells into that stroke, or the bed of the damage. And they were surprised because even though they only did 18 patients, it was a non-blinded trial, meaning that everyone knew that they were getting the stem cells. The recovery was somewhat remarkable. And so as Dr. Steinberg mentioned, it wasn't just the case that people couldn't move their thumb and now they can. Patients who were in wheelchairs are walking now, is a quote he gave in the press release. And so that has people really, really excited, which is lent itself to the second part of the study, which is a new multi-center phase 2B that Stanford's leading. And if people are interested, they should email stemcellstudy@stanford.edu to get more information to see if they qualify.
Awesome. And we'll have that link in the show notes as well. So that sounds good because 18 people getting really good results. That's awesome. But 18 is not a ton of people.
That's correct. 18. And to be clear, they screened almost 400 people just to find those 18. So they're trying to be very cautious. They're trying to make sure that they intervened and did research on the right people who understood the ramifications of the research. And so there are a lot of caveats in that small study, although very hopeful. And that kind of lends us to talk about maybe the next phase of how people are also using stem cells in stroke, coming from Miami.
Right. So what are they doing in Miami? That seems like that's a prime area for a lot of stroke and a lot of stroke recovery that has to happen with some of the challenges that we see in the Southeast regarding stroke.
That's correct. Yeah. And the group in Southern Florida and University of Miami specifically are really excellent. Dilip Yavagal, who's a neurointerventionalist and a neurologist by training, has been leading efforts in stem cells for many years. And his approach is slightly different than the Stanford group's approach. His approach and the collaborators he works with have implanted stem cells, again, from the person's own body, so autologous stem cell. In Dr. Yavagal's study, the difference is that it's done through a catheter, through a minimally invasive approach, in the same way that thrombectomy and embolectomy is done. So as opposed to drilling a hole in the patient's skull and injecting the stem cells into the bed or the area of the stroke, this is done through the catheter into the arteries. It's just an injection that's very targeted into the actual general region where the stroke occurred.
So it's easier on the recovery for the patient, presumably, and...
Presumably it's safer because you're not drilling into the skull, and potentially it's targeted because the idea that his group and others are advocating as well, you need to promote what people refer to as vascular genesis, meaning the recovery and regeneration or the creation of new arteries to support the recovery of the brain. So there's no point in brain recovering if you put stem cells into brain tissue if they don't have blood flow. And so that's somewhat where the debate falls, is do we want tissue to regenerate or do we want the arteries to regenerate? Probably the answer is both. And the best way to get there is still up for debate.
Interesting, because I think a lot of folks wouldn't even think about the blood supply system. It's all about, I want to grow more nerves.
Well, that's the irony, right? That's how they got the stroke to begin with.
Exactly.
They lost the blood flow. Yeah, exactly. Yeah, that's true. And so there are definitely caveats with all of these. And, the real consideration scientifically is that fetal stem cells or other embryonic stem cells are not the same size as embryonic stem cells. Part of the issue with mesenchymal stem cells, or the kind that we're using for these studies, is they're substantially larger than the capillary bed itself. So a capillary is in the order of microns. These, as mesenchymal cells, can be on the order of 300 microns. So one would wonder if it's possible that these mesenchymal stem cells would just get stuck. How do they even get to the capillary? And so in our discussions and in our meetings where we talk about this, Dr. Yavagal's group has had to do work kind of articulating and showing 3D models and reconstructions in translational evidence, specifically dogs, unfortunately, where they've done the basic work to cause a stroke and then inject the stem cells to see where the stem cells would grow, so that there would be a logical mechanism for this work to make sense in humans. And so that groundwork had to happen. That's probably the phase 1 work. Now we're in what is generally referred to as phase 2 and phase 3. Phase 2 is safety in humans. Those are the 2 studies we just talked about, the Stanford study and the study that was done with people at the University of Miami. And then now we're headed into the phase 3, which is many people at many centers participating in this before it gets FDA approved. And in the phase 3 studies, which we're hoping many survivors of stroke would want to participate in across the country and also in Europe and other parts of the world, is that we would get efficacy data. To date, what we've learned is that this is a reasonably safe approach, and it certainly doesn't harm patients. You know, as physicians and clinicians, we take the Hippocratic Oath, and the first statement is do no harm. So when people ask us, can we do this or can we do that? You know, we're excited too. We're science nerds and we watch Star Trek, Star Wars. And so in general, the people who are in healthcare are really excited about the future, but we always have to ask ourselves how to not do harm first. And that's why we do this basic work before we do the efficacy work to make sure it has effect in people.
Right. So a lot of folks out there who are looking and seeing all of this stuff, it's not there today, but it's something that could be there in just a couple of years.
Yeah, we're not far away at all.
This stuff has been really exciting. So as you look at what you're seeing in this field, what are you most excited about for it? And what do you most look forward to potentially in the future bringing to Swedish?
Yeah, so the exciting thing for us, I think, is that stem cells in this first round of studies may not be the right answer in and of themselves, but I think they get us much closer to recovery, modification, protection than we've had before. And I think what we'll learn is that we'll have to make certain modifications to the stem cells through meds or chemicals or genetic modifications, editing, so that you could take your own stem cells, they're modified for success, so that they can help your brain recover and the arteries that were responsible or related to the stroke. And so I think over the next few years here in Seattle, we'll be participating, hopefully through studies that come through the National Institute of Health. And ideally, one day, this will just be a simple medical procedure that we say is standard of care. And I hope that's not more than a decade away.
Awesome. Something to look forward to. So, Nirav, thank you so much for joining us this week. I think this has been a great primer, and we're looking forward to learning more about stem cell research in the future.
Yeah, thanks for having me. Look forward to talking more soon.
You know, it's always great to talk with Nirav, and he'll be back in a few weeks to talk about SSRIs and the FLAME study. I also have some more episodes coming up where we'll talk more about research into stem cell treatment, so keep an eye out for that, or I suppose keep an ear out for that. And that brings us to our hack of the week. This week's hack is a product called the Gropener, Gropener. It's really an unfortunately named one-handed bottle opener that's perfect for soda or beer. It sells for about $16 on Amazon. And you can go ahead and find a link to that product over at strokecast.com/Gropener. I originally talked about opening bottles back in episode 7 with how to do it one-handed with a traditional bottle opener. And that was a solution that worked well for me, but it was a little more challenging and there was the potential to spill. This product is so much better. Basically, it's designed so that you put it on the lid of the bottle and sort of squeeze it against the neck of the bottle with, again, just one hand through the whole process, and the lid just pops right off with no risk of spill. So definitely go ahead and check it out. It makes opening up those bottles so much easier. So we talked about a bunch of stuff in today's episode. What do you think about these innovations in stem cell research? Do you want to be an experimental subject? Let us know your thoughts in the comments over at strokecast.com/stem cells. And of course, be sure to check out all the links from today's episode, also available at strokecast.com/stem cells. What else would you like to hear Dr. Shah talk about on future episodes? Again, you know where this is going. Let us know in the comments over at strokecast.com/stem cells. Be sure to check out Strokecast on Facebook and give us a like for even more videos and even more thoughts and various discussions. That's again over at facebook.com/strokecast, or just log on to Facebook and search for Strokecast in the search bar. Take a look at the Gropener on Amazon for all of your bottle opening needs. And of course, as always, don't get best, get better. Thanks a lot. I'm Bill Monroe, and I'll talk to you next week.
The Strokecast, Bill Monroe, and Bill's guests provide general information and entertainment, not medical advice. Please do not make any changes to your treatment plan or the execution of your treatment plan without first consulting your personal doctor or medical team. The Strokecast is a proud production of the Currently Speaking Podcast Network.